Okay, so we'll just start with a little intro. So we're going to be doing this over the next 6 weeks. So each week I'm going to build upon the last week, doing a little bit more. So we'll be doing things a bit slow today, staying in positions for a little bit longer and just getting used to things. And then it will pick up each week and we'll be adding some more things on. And then the other thing is, I know some people get a little bit, I don't do yoga, so if you have any friends out there that you think would benefit from this, encourage them to join. Yoga is really just about breathing and moving your body. It's not about seeing who's the most flexible or having perfect posture. It's just about seeing where your body is today and seeing how we can move it to make it feel a little bit better. So we're going to be focusing a lot on awareness and breathing and things like that. So with that being said, listen to your body throughout the class. This should make you feel better. If your body's saying, what's this stretch about? You feel uncomfortable, it doesn't feel right, just stop, okay? Find a comfortable position and focus on your breathing. And then we'll have a little question and answer afterwards. So if you have any questions on anything, let me know. But this is really about listening to your body. And you should feel a gentle stretch with everything. I know people think with yoga that you really have to push into it, but our muscles have a natural reflex to tighten up if it feels like it's going to be overstretched. So if you're really pushing into like really deep stretching, you're not going to actually lengthen that tissue because your muscle is just going to tighten up to protect yourself so you don't get injured. So we want to feel a gentle stretch and hold it there. If anyone, I don't think anyone right now is, but if anyone's listening to this later and you're pregnant, just make sure that you have a couple extra pillows either behind your back if we're lying on your back, or to twist you to the side so you're not lying prolonged on your back. And if you have a prolapse or if you're not sure, just make sure with a lot of the breathing that you're not pushing and putting too much pressure on the pelvic floor. So just nice, gentle breaths and making sure that whatever your issue is, whatever's causing you pain, that you're listening to that, and if something's making your symptoms worse, that you're backing off and making sure you're not pushing through that, okay? So I'm going to screen share a little bit one more time. I just want to show this picture that I really like. So today we're going to be talking a lot about breathing and focusing on the breath. So can you see this all right? So what we're going to talk about is 3 steps to better breathing. So making sure that we're breathing down, not up into our chest. We learn to breathe up into our chest, they can't see me, for some reason. Maybe you have a stuffy nose or things like that, but the normal breathing pattern should be down into our lungs, expanding that rib cage and breathing under that rib. So we like to say barrel breathing or something like that. Sometimes people say belly breathing, but we don't want it to be just your belly. We want to have a nice expansion in that rib cage and relaxation of the lower back. And as most of you probably know already, a little bit of a relaxation of the pelvic floor as well. So we're going to keep that in mind as we start and as we move through some of our breathing. So we'll just have you come to a comfortable position on your mat. If you want to use a pillow, I want you to stay comfortable. So we'll start off just lying on our mat. Keep your knees bent up. If you really want to put your legs out, you can put your legs out. Otherwise, we're just going to keep our knees bent up, relaxing, and just bringing some awareness into our body. So just seeing where you are today, feeling what your feet feel like on the floor, what your hips feel like. Maybe you're more towards the right or the left, and just noticing how your body is feeling today. If it feels tight anywhere or sore anywhere. Feeling what your shoulders feel like. Is one shoulder higher than the other? Are they relaxed? Where's your breath going? Is it going mostly up into your chest? Or down into your ribs? Can you feel your back expand and your belly expand? What does your neck feel like? Are you twisted to one side or the other? Are you holding tension in your jaw or your head? maybe your forehead or your eyes. Just feeling where your body's starting off today. And then coming to focus on the breath. So let's try a breathing pattern where we're going to breathe in through your nose, expanding those ribs, and then out through your mouth, the gentle exhale. You might place one hand on your chest and one hand on your ribs so that you can feel that breath. Trying to send it to the ribs, inhaling, expanding, exhaling, returning to normal. Inhaling through the nose, exhaling through the mouth. You might notice a little bit of a tightening of the abdominal muscles as you exhale. You might start to feel a little bit more movement in the back as you inhale into the back, relaxing the pelvic floor, exhaling, returning to normal. So now I want you to take a couple breaths, focusing on different areas. So we're going to try and breathe, inhale to the right side into the pelvic area. And take a couple breaths here, breathing into the right side. Noticing where your breath is going. Do you feel your back expand? Do you feel the pelvic floor lengthen? Then trying the left side. In through the nose and out through the mouth. Couple breaths here so that you feel even on both sides. Now we're going to start to do a little bit of a tilt with our breathing. So we're going to breathe in, let your back come up off the ground, arching a little bit, those hips roll up. Exhale, back comes flat. Time for class to start. Inhale again, let your back arch up. And exhale, returns to normal. And so a little bit more rolling in the hips. So inhaling, coming up, and exhaling, return to normal. So here you can keep breathing in through the nose and out through the mouth if that's comfortable, or you can return to in through the nose and out through the nose, whatever feels more natural for you. We'll take a couple more breaths here, making sure that you keep it in a pain-free motion. So if the back hurts or the hips hurt, just a little bit less rocking and a nice gentle range of motion. Okay, so now we're going to inhale the right leg up, crossing it over. Now if this feels good here, you can keep it here, or you can pull the left leg towards your chest to feel a gentle stretch in the back of that right glute. If you're feeling pinching or anything in the front of the hip, then I want you to relax down here and just stay here. Inhaling through the nose, letting those ribs expand. Exhaling, return to normal. Now we're going to take that right hand and grab that right side of the foot here. If you're comfortable here, you can leave your left leg up. Otherwise, you can straighten that left leg. This is half happy baby. You should feel a nice stretch in the right leg, maybe in the pelvic floor. Alternatively, you can hold the right knee here if that's more comfortable for you. So remember, find that comfortable position and just focus on breathing here. One more breath. And then we're going to twist over, letting your right leg drop across your body, coming into a twist here. If you need a little bit more of a twist, extend your right hand to your side, looking over the right side. Focusing on your breathing here. If this is too much, bring your head back to the left, where you could bend both knees up. We want to feel a comfortable twist through the spine. Holding it here. Inhaling, expanding those ribs. Exhaling, returning to normal. On your next exhale, we'll come back to the center. We're going to inhale the right leg up, trying to straighten that leg. A nice stretch of the hamstring here. If this is too much, you can leave the left leg bent up. Trying to straighten that leg as much as is comfortable, feeling a nice stretch in the back of the hamstring. Okay, lowering the leg, picking the left leg up, crossing it over, figure 4 on the left, holding it here or pulling it up, feeling that stretch in the back of the left. Still trying to get that nice inhale with a little expansion of the ribs. Exhaling, trying to find that comfortable stretch. Now same thing on this side. Left hand is going to grab the outside of the left foot, coming to half baby, either keeping the right leg up, putting it down, and either staying here or simply coming and holding behind the left knee. And breathing. Does this side feel different than the right side? Noticing what your body's doing, where the tightness is, trying to keep the jaw relaxed and the shoulder relaxed. And now from here, we're going to cross over, letting the left knee drop down to the right side, reaching that left arm out. And taking the position that's comfortable for you, bending up both knees if that feels better. Keeping your neck in a comfortable position. Towards the left if you want a bigger stretch. And breathing. Can you feel your ribs expanding in your breath? On the next exhale, coming back to the center, inhaling that left leg up, hamstring stretch. Lowering the right leg if you need more of a stretch, keeping it up if you need to protect your back or your hips, and just holding that stretch where it's comfortable for you. Try to keep the shoulders relaxed, the jaw relaxed. Let go of any tension in your forehead or between your eyes. And lowering down. Now you can rock up or you can come to the side, but we're going to come into a sitting position. So now we're going to bring the left leg behind us, The right leg stays out in front. Trying to see if you can relax your hips down. Focusing on your breathing. Expanding the ribs and relaxing. Then we're going to switch our feet. So the left foot is going to come in front and the right foot is going to go behind. Noticing any differences in the right and left hips. If you can, relax that hip down. Otherwise, finding the comfortable stretch for you. Some nice deep breaths. Then we're going to come up onto all fours. We're going to do cat-cow. So arching your back, letting your head drop down. And then looking up gently, letting the back sag, keeping the neck comfortable. So now we're going to add some breathing with it. So I want you to inhale, look up. And then exhale, let your head drop, arch up. Good. Inhale, look up, let your back arch down. Exhale. And a couple breaths just flowing at your own pace. If it feels good, you can stay in one position for a couple breaths. You might wiggle back and forth if you need to. Feeling what feels good for your body. And then returning to inhaling, looking up, exhaling, down. And coming to the center when you feel like you're even. And we're going to sit back into child's pose now. So you might use your pillow here to relax. Put it on your chest. Reaching the arms out in front of you. Your bottom's coming back onto your feet or as far as is comfortable. Now you can relax your arms by your side as well if that's more comfortable for you. You might need a second pillow to go on your feet as well. So coming to a position that you feel relaxed in, focusing on your breath, trying to send that breath deep into the lower back, relaxing those muscles, relaxing your neck and shoulders, inhaling, expanding, exhaling, returning back. On your next inhale, come back up. And you can move your pillow and we're slowly going to come into standing. Okay, so what we're going to do in standing, I want you to feel where your sit bones are. So you might do a couple little mini squats and feel those hard bones right in the middle of your glutes. Okay, so just bring some awareness. Feet are about shoulder distance apart. Shoulders, hips, and feet all in a line. We're going to do a couple mini squats. So I want you to pretend like you're sitting down into a chair, feeling those sit bones, and then standing up a little bit. So now I want you to feel when you're bending, are those sit bones spreading apart? Are they coming together? Or are they just staying in the same place? So as you're coming, I want you to really sit back. So knees are going to stay back and you're really getting a nice bend through the hips. There you go. And come back up. Good. And a couple more, just sitting back, feeling what's happening at those sit bones. So what should happen is that as you come down, they should come apart a little bit. And as you come up, they should come a little bit closer together. So those sit bones should be going out and in. You might feel one moving more than the other. You might not really feel them moving much. And sometimes when you have a lot of tightness, they're not moving like they're supposed to. So coming into a little bit of a mini squat, and then focusing on staying here and breathing. Inhale. Can you feel those sit bones spread a little bit further apart? Exhale, returning to normal. Inhaling, a little bit further apart. Exhaling, coming back to normal. And then standing up. Now we're going to spread our legs wide and take a wide stance here. And just get some gentle movement through the hips. So just doing some gentle side lunges, back and forth. And then if it feels comfortable for you, holding it on one side, a couple breaths here. Just feeling a nice stretch in that inner thigh. Coming to the other side. Focusing on your breath. And now come to the center when you feel even. We're going to inhale our arms up. Exhale through heart center. Inhale, arms up. Exhale through heart center. One more, inhaling up. Exhaling down. Okay, now we're going to gently come down into sitting. So again, if you want your pillow, we're going to come back into our position, lying down, head on the pillow, feet stay up on the floor. And now we're going to try inhaling, bringing your bottom up, off the ground, and doing a little bridge. Inhale, release. And exhale, a little bridge up. Inhale, relax down. And now we're going to inhale up again. And I want you to come as high as you can come without feeling any tension in your thighs. So you want to feel your glutes working, but your back stays relatively relaxed. The thighs stay relatively relaxed. And you can really feel those glute muscles working here. So some people might find that a higher position, they can feel more in their glutes and they can stay relaxed elsewhere. Some people might need to come a bit lower, squeezing the butt, focusing on the butt and making sure that your thighs stay relaxed, that the back is comfortable. And relaxing down. On your next exhale, you're going to lift up again. Keep breathing while you hold it here. Focusing on where you're finding the tension. Making sure your legs are relaxed. Not holding any tension in our thighs. And breathing. On the next inhale, relax down. One more inhale. And exhale, lift up. Coming to that position where you feel most of the work in your glutes. Breathing. And then relax down. So now we're going to come into happy baby. So you can either hold your feet in this position or just behind the knees. Letting your legs relax out to the side a little bit. Again, making sure that you feel that in the back of the legs or in the pelvic floor. We don't want to feel any pinching in the front of the hips. So you might give yourself a little Squeeze, bringing the knees in if that's comfortable for you. And then we're going to come to a comfortable position. So you can either come back with your feet on the ground, or you can spread out, let your legs fall out and take up some space. So coming back to the breath. So taking some time to focus on your breathing. You might count your breaths here up to 10, and then starting over again at 1. Anything that keeps you focusing on the moment. Some thoughts will wander into your mind, that's normal. Acknowledging them, and then coming back to focusing on the breath. Inhaling through the nose, expanding those ribs, exhaling, returning back. Inhaling and exhaling. Slowly start to wiggle your fingers and your toes again, bring some awareness back to your body. Rolling onto one side when you're ready, and gently pushing yourself up, coming into a seated position. If you still have your eyes closed, that's fine. Take a couple breaths here. And then slowly bring them open if they're not open already. Taking a moment here just to recognize what a great work you did, and thanking yourself for being here and thanking your body. We'll bring our hands together. Namaste. Thank you guys for joining me.